Times are definitely changing. You hear stories about hysterectomies that were done, 10, 20 years ago, where people had to be bedridden for 6 weeks and recovery took months and such. Times are definitely different nowadays, thanks to all the technological advances that have happened in the last couple of recent years. A couple of examples, for instance, is just the advent of laparoscopy, which now pretty much has taken over most of the surgical procedures that we do. We don't have to make big incisions anymore like in the old days. We can pretty much get away with whether the problem is for bleeding and doing a hysterectomy, or if we're doing surgery for big ovarian cysts. We don't need to make those big incisions in the belly that we hear mothers or grandmothers used to have. We can get away with just doing small little incisions the size of the width of your finger, which means way faster recovery times and better outcomes. Robotic surgery is a great instrument that just recently started to be used in the medical field, approximately 5-7 years ago. And as far as the field of gynecology specifically, it definitely took off in the last 4 or 3 years, to the point where a lot of our procedures we now do robotically. And the biggest benefit of it is there used to be cases where, say there's severe scar tissue or severe endometriosis and such, that even, with being skilled laparoscopists, it was still challenging to, take care of these patients, given the amount of scar tissue and such. And sometimes that meant longer surgeries, or sometimes that meant actually opening the patients, actually doing a big incision in order to take care of them. With robotic surgery, a lot of these complicated cases we now can actually take care of without doing that. And basically what the patient ends up with is just, 3 or 4 little holes in this size, which means goes home the same day or the next day, is up and around within a week. And like I said, it's a great instrument. And here at Zeid's Women's Health, there's several of us that are well trained in this new technology, and happy to use it for consultation.